started. Good afternoon, everybody. Welcome to our event today on myths and facts about the COVID-19 vaccine. As some of you may know, we did have part one of our event on January 27th, and the recordings are available in Spanish and in English on Chicago Check's YouTube page. So we'll go ahead and post that in the chat so you guys also have a link to those as well. And I'm Alicia Kalamian. I'm a community health educator with Northeastern Illinois University Center of Health, and I'll be facilitating today's call. We also have Dr. Melissa Simon, who is our health expert on the call. She's from the Center of Health Equity Transformation at Northwestern University. And we both also do collaborate on the Chicago Check grant. Also wanted to give a special thanks to all of our collaborators, NEIU Center of Health, the Center of Health Equity Transformation at Northwestern, Chicago Cancer Health Equity Collaborative, also known as Chicago Check, and NEIU's Health Services. Also just want to give a few little reminders. Please stay muted unless you're speaking, just to make sure that we can all hear each other and those that are the information being shared. Feel free to use the chat box to answer any questions or comments that you may have. Also, you're more than welcome to share your video if you aren't already sharing it. And without further ado, I'll go ahead and pass the baton on to our Q&A and open discussion. Oops. 1 second here. I'll just stop my screen. All right, we can go ahead and get started. Did anyone have any questions that they would like to kick us off with? You can go ahead and verbalize them if you'd like. All right, well, Dr. Simon, I can kick us off with one of the questions that were submitted. So do you still have to wear a mask and socially distance after getting the vaccine, and why?
Absolutely, you do, because we don't know the answer to the question. Can you still get COVID with the vaccine? And if you get COVID, we do know if you have the vaccine and you get COVID, we know from the clinical trial data that you will have a low likelihood of having a bad case or a severe case of COVID-19, meaning you would likely not enter the hospital, likely not need breathing support or a tube down your throat. And so that's what we do know about the vaccine. What we don't know about the vaccine is if you could potentially get other strains of COVID-19 mutations, and if you can give them to somebody else. And that usually comes in phase 4 clinical trials, which are the types of clinical trials that are being studied right now from the people who've been in the trials already in the phase 3. So there's different phases of clinical trials. And so right now, the Pfizer and the Moderna vaccines, for example, are being tested to answer these questions. So until we have more data, we're not going to know. And thus we have to just keep telling people to mask up. And even if they have the vaccine, regardless of which one they got, and socially distance or physically distance to the extent that they can.
Thank you. Did anyone in the audience have any questions at this time? I'm going to keep going back and forth to give everyone a fair chance to ask any questions.
Question following up on that. So I think now that people are getting vaccinated, which is great, there's a lot of people wanting to know, okay, when can we see each other again? Grandparents who want to see their grandkids, friends who want to see each other. And, you just said about continuing, masking and social distancing. So, what kind of messaging should we all be having with the people in our extended circles about those sorts of requests or wishes?
It's a hard question to answer, and it's an important question to ask. And so that's where I again go back to the fact that we don't have enough data on the fact that once we get vaccinated, regardless of which vaccine we receive, we don't know if we can still get coronavirus and transmit it to other people. So again, I think the safest thing, my my strong guidance is to stay physically distanced to the extent that you can. Have to wear masks. And can you see grandma, grandpa? I think I again would caution, because we just don't know. But I also don't want to prohibit, people from having that opportunity. I think we need, the issue is that when you go to grandma, grandpa's house or auntie's house or friend's house, there is a variety of people you get in contact with to get there, whether it's through airplane, car, walking, train, whatever it is. And so you're still going to be exposed to a host of other people. And again, like I said, you could get another strain of COVID and transfer it to grandma, grandpa when you see them, and you don't know that. So that's the issue. So what I would say is unfortunately, I think some of this 2021, we're going to be back to normal messaging that has happened over the last several months is not true. And we're not even close to getting towards herd immunity yet. We really, really, really need about 80% of the entire planet's population to get vaccines in their arms. And we're not even close. Even when we start to receive the doses, because we're going to get more vaccine doses coming into the country, we still need to get the vaccine doses into arms. And that has been a challenge now, is more on the we have demand for it, but we don't have the supply. But once we get the supply, we need to have the demand and the continued demand. Right now, the demand of the population is not at 80% to actually want to get the vaccine in the arm. So we gotta keep, moving forward with obviously getting what we have in the arms of people, but we also have to make sure that as we get more people vaccinated, there's going to be a need to really help get the information to the people who are a little more hesitant or more on the fence to get the vaccine, kind of the information they need to help them get to a yes and get vaccinated. So it's going to take this entire year, highly likely, to even get, and it probably won't even make to 80% by the end of this year. It's my prediction. I don't want to be a Debbie Downer or like negative, because I'm usually quite an optimistic person, but it's going to take a lot more work. We're not there yet.
And you make a good point. Optimism is definitely what we want to strive on and especially during this time. But there's also this realistic factor that we all need to have so that we're prepared in the expectation, and not, expecting things to be good in 2 months and then be disappointed, because that could also have negative effects on people too. So being realistic of kind of what to expect is, I don't know, at least for me and within my family, it helps us feel a little bit more comfortable with the situation and how things are going, and being patient with the process.
Yeah, I think that's right, Alicia, is being patient with the process and understanding that this process is complicated. We're talking about an entire planet. And yes, we have to focus on our country and specifically our state and city and surrounding suburbs, but we know that we're all like one. Right? So if one country is not doing well on this planet, we're all not doing well, right? If one part of the city is not doing well, we're all not doing well. Because as long as there are humans that have machinery that can be invaded by this virus, right? There's going to be the opportunity for the virus to come into our machinery. We're like Airbnbs for the virus, right? Coronavirus comes in. A virus is like it comes into a place, a cells, the human cells, like an Airbnb, and they take over and they start replicating. And as soon as the virus starts replicating, that's when mutants get formed, because they don't replicate perfectly. And so mutants get formed, and so more mutant strains of coronavirus will be produced. And so that can cause more contagious variants, more deadly variants, or less deadly variants and less contagious variants. But we've got to shut down the Airbnb for COVID-19. And the only way to do that is to get us all immunized. And that's what we mean by herd immunity. I hope that that concept is like bread and butter. That's what it is. And that's why we need to get about 80% of people vaccinated against COVID-19, is to shut down the virus's opportunity to replicate. Because if they don't replicate, there will be no mutant strains, right?
Mm. And
Does that make sense to people? Because that's the fundamental concept. That's why we need vaccines in arms. Shut the factory down.
Yes. I think we're all on board with shutting that factory down as soon as we can. Of course, within the time frame that is allotted and when we can do it. But I know someone had submitted a question kind of similar to when you were talking about, mutated versions of the vaccine and things of that nature. Does the vaccine protect against some of these newer or mutated versions?
As far as we know, it does a fairly decent job. There are strains though, so again, that's why we need more research and genomic typing of the virus and the different strains, because we don't know how many strains are actually around right now. But for what we do know, it seems that the Pfizer and Moderna vaccines, which are the only two approved in the United States, are fairly okay against most of the strains, but we don't know how many strains there are, right?
Mm-hmm.
And Dr. Simon, so I have a lot of family members who are really skeptical about the vaccine, as I'm sure we've talked about already, and they are the same family members who are still even skeptical of the flu vaccine. And, just for the same reasons, like if I get the vaccine, will I be getting COVID-19? If I get the flu vaccine, I'll be getting the flu injected into me. And I keep hearing that a lot, and I try my best to explain to my family members how it works, but they are very stubborn and tend to, it's just harder to get them to understand, I guess, more of the facts. And I'm just wondering, are there like informational resources or maybe like infographics or something more like user friendly, especially in Spanish for my family, but in general, are there like any kind of infographics or resources we can share with our families and with our communities regarding the vaccine, the COVID-19 vaccine, anything that might be useful to them, so that, they're not just hearing it from me, and maybe they'll see something more official and they'll be like, okay, I'll listen to this.
Yeah, so the first and foremost thing is to understand that these two vaccines that we have for COVID-19, the Moderna and the Pfizer, are different than how the flu shot is made, how the flu vaccine is made. These two vaccines are messenger RNA vaccines, so they're totally different. You don't get coronavirus, you don't get the COVID-19 injected into you in these vaccines. It is not a killed version like a lot of the flu vaccines are. They're killed versions of the flu, or an adenovirus, a different type of virus to spark your immune system. What these messenger RNA vaccines are, the Moderna and the Pfizer, are they're kind of like they go into your body. They do not go into your DNA. They go into your body and they teach your defense system. So you have an immune system, right? You have an army that arms you, that protects you from invaders, right? Protects you from other viruses, colds, bacteria, all this stuff, right? So each of us has our own natural immune system, and which is our army. And so what the mRNA vaccines do, the messenger RNA, they come in and they train your army. So they basically show your army a wanted sign, and it says, they come in with this poster and they say, hey, look, this thing with the crown on it, the corona, this coronavirus is bad. And when you see this corona, this spike, this gangster spike protein, you must attack it. And that is exactly what that messenger RNA does. The vaccines do. They go into your body and they literally gather up your immune system, your army, and they say, yo, army, we're gonna teach you who you need to attack with respect to COVID. And whenever you see this gangster spike protein or this coronavirus, you must attack it. And that is exactly what the mRNA vaccine does. So maybe if you explained it that way, because it's really hard to find an infographic that explains it that way, unless somebody wants to draw what I just said. I haven't seen it drawn that way. But that is exactly what it does. And all it's doing is it's training your army. These two vaccines that are approved, they train your own body's army to attack a specific protein, to attack the coronavirus that looks like a very specific thing. It has a corona, has a crown, the spikes.
Yeah, thank you so much. That's very helpful, and I'll definitely use that. Yeah, it would be great if I don't know.
Yeah, I know. There's stuff like on the CDC website in Spanish and English. But I haven't seen it honestly explained that way anywhere. But that's really what happens. That so it's different mechanism of action than the flu shot. And if you can explain it that way, it might be helpful. That the flu shot is not, just because it's called a vaccine doesn't mean every vaccine works the same way.
Thank you. I know Nemo did put a few resources in the chat too that she had found, so those could be also some nice references as well. And I know, Dr. Simon, you kind of talked about this last time too, but just to clarify, does the vaccine have any effect on our DNA?
No, it doesn't go in at all. Like I said, it really is a messenger RNA. It's not DNA vaccine. It's not a virus. There's no virus being injected into your body. It just literally is sending a message, and the message is the wanted posters and the army training that this picture of this coronavirus is bad. Whenever it trains your army to look at this bad picture and go find it and go attack it.
Thank you. Did anyone in the audience have any questions that they'd like to ask? And just checking in with everyone. All right. So another question that was kind of getting submitted, I know we were kind of talking about the flu shot. Is this vaccine going to be something that we're going to have to do like every season? And are there boosters? Do we know enough information about that right now?
We have no idea. We don't. And that's, again, what phase 4 trials are supposed to do. So whoever has been participating in the trials now have signed on or have agreed to continue to be followed over time. And what they'll be doing is what the scientists will be doing is taking blood, looking at antibodies to see if the people who receive these vaccines still have antibodies, which are your army that will fight coronavirus, and what are the levels as they go over time. So we don't know the answer.
So hopefully in good time we will have the answer. So as science progresses,
it's gonna take months.
Yeah.
It's gonna take some months, at least some months, if not more than some months. I want to be, maybe by fall, again, it's very unsatisfying.
Yeah.
This is a pandemic. This is around the world. This is a huge, big deal. And we are behind the 8 ball. We're just starting to get our act together, even just in this country. Some countries have it a little bit better together. But, you know, we unfortunately got too much of politics entered into public health space. And when that happened, it knocked the public health movement and momentum that needed to happen, it knocked it off the track. And so we're back on track, but it goes really slowly when you first start on that track. And that's where we're at still. There'll be more momentum and it will get better by summer, but we still won't have enough data, I think, to be able to say, well, do you need a booster in 1 year, 2 years?
So again, kind of just being patient with the process and
How to be patient
and hoping for the best.
Yeah. And celebrating the things that have been gained through quarantine. And I know it's hard to look at the bright side, but there are some things that have been gained. I mean, for better or for worse, my children have probably seen me more through Zoom school, right, than getting to go out. And, you know, maybe that's a better thing for me than them for now, but, you know, some positive things have happened.
I agree. I feel like even in our family, we've connected with people, you know, our family members reaching out more, checking in on everyone. And there's been almost like an increased connectivity that we've experienced within our family and friends and network that we've had. So it's brought, in some cases, us closer together in a very not physically close way.
and that is totally actually okay. It's okay. I think if we can celebrate some of the wins or some of the bright spots, I think that will help us get through at least the next few months during the cold weather. And then the sun will come out and, you know.
Another thing I realized, me and my cousin, the mask actually keeps you warmer in all this cold weather. So
heck yes. Yes.
there's a positive.
Yeah, no, it's the scarf around my face that my mama and my grandma, my abuela always said, like, Melissa, don't go outside without a scarf around your face and a hat. And now I do, right? Because of the mask. The scarf that I never had.
I would also like to share that with 2 little kids, every summer or every winter since I've had kids, everybody's sick because that's what little kids do.
That's
they're
right.
in school now, but they're wearing masks.
That's right.
Knock on wood.
Yeah.
But it's been a different winter. I don't want to jinx it. But you know, I look at pictures from years past, every January, February, all of our voices are lost. And it makes me think about what sort of continued practices we might take into things, you know, in years to come, because it really has affected, I think, just overall the general illness that I know typically happens in my household.
That's right. That's exactly right. Less runny noses, less coughs, right? But then when you do cough once, everybody's looking at you like you're sick, you're infected, you got the disease, and forgetting that there are a lot of other rhinoviruses and just cold viruses around, but a lot less. And you know, obviously, influenza has been less this season as well because we're masking, physically distancing, hygiene, all of those things.
Yeah, I wanted to just kind of mention too, part of the, I guess, like silver linings of the pandemic. I've noticed, you know, while I like having the privilege to be working from home in Iowa, that you know, I get to see like my mom and other, like my aunts and uncles and extended family, they all get to connect a lot through, I mean, everyone uses Facebook. In our family, extended family, I think a lot of Latinos in general and a lot of folks like use Facebook. But, you know, they have the, similar to Zoom and everything, they can all chat via video and have like a bunch of folks on there at once. So technology has been like such a gift during these times because it's allowed them to get a lot of much needed social support that they might have not been able to get otherwise, or, you know, just by talking by phone audio, it's just not the same as being able to kind of see folks there. So I've seen that as a real benefit, just like firsthand within my own family. But I've also kind of noticed how those outlets can sometimes not work in our favor in terms of like the broader public health agenda and getting the appropriate messaging out in terms of the safety of the vaccine. So I've often also, been asked by like my mom and others to like let them know about the safety of the vaccine and other things, because they saw someone post some YouTube video of some doctor who he was talking about the vaccine not being safe and things like that. So I guess it kind of leads me to this question of like how do we like educate our loved ones and others in our communities of these mixed messages and like third-party outlets that are kind of spreading this this misinformation.
Yeah, I think the third, we have to acknowledge that there is more than just a pandemic of COVID-19. There's racism, but there's also misinformation. And I think that is driving a lot of this. And we're going to see it. We're going to see that impact even more when the demand side for the vaccine gets satiated. So once the folks, because right now it seems like a lot of people want the vaccine, but it's not 80% of the population. I can't even guess, and maybe 30 to 40% of the population perhaps that are willing to get the vaccine if it's their turn. But we're going to see that misinformation be more front and center once we hit like a wall, or we have several vaccines to give to people. We have the supply, but we no longer have the demand. And that's when we'll see it the most. And so right now, the best thing we can keep doing is staying on message and trying to help avail information from whoever the trusted messenger is to the people who need it. So whatever it is to help people get to their why. And some people, quite frankly, want to wait for the one-shot vaccines, right? Instead of having to get 2 shots. Some of us fear needles. And the Johnson & Johnson vaccine, for example, when it finally goes through, when it finally applies for an official emergency use authorization and then gets approved, that will be an option for some people who just fear needles and only want 1 shot. So there's a lot of things about misinformation, and there's no good answer other than to try to keep staying on message, try to get some people who are on the fence about vaccination or vaccines more convinced. But it's just a process. The worst thing that we can do right now is shame people because they haven't gotten a vaccine yet if they were eligible, right? Or shame them because they're hesitant about taking the vaccine.
And I think
Yeah,
that
no,
also,
definitely. Those are great points.
I also think that some people do also get shamed for getting the vaccine too. That's another thing that I've seen. Like, some people don't want to say that they got it because they feel that somebody else should have gotten it before them, or whatever, someone might be thinking regarding it. And
Right.
it just adds to that.
Right. Yeah. It goes both ways. You're right. And there may be some people in families that where some of the family members disagree about the vaccine. Right.
Oh, yeah. I see that a little bit in my family too. Just in general with COVID, half of our family is feeling one way about it and the other half feels another way. And, my grandma, she doesn't speak English very well. So sometimes, the beginning of this process, explaining to her why we can't come inside her building. She lives in a senior citizen building. We can't come inside. Oh, are you sure? Can you come in? No, Meds. I'm sorry. I love you, but I can't, so.
Mm-hmm. Right. It really is trying to keep the message of patience. Things are going to get better. We're now on the right track. but that first beginning of that track is always that, that steep climb, right? We haven't gotten to the top of the hill yet, or the mountain. So we just have to be patient.
Mhm.
I had a question following up on before you mentioned that some people might be waiting for the Johnson and Johnson, and I know that that one is reported to have like less efficacy rate compared to the Moderna and the Pfizer. And we know now on the CDC website that if you're a person who is prone to severe allergic reaction, you shouldn't get Moderna or Pfizer. Would the Johnson and Johnson be a safer alternative for individuals who are potentially immunocompromised or even prone to severe allergy?
I mean, those are all great questions. I haven't looked at all the data because when they apply, right? So, well, first of all, let me start with the first thing. 66% or 67% efficacy is great, right? So I would not be worried about that number versus 94 or 95%. Different trials, different people participating, different type of vaccine completely. So we were hoping in the scientific world for a vaccine that was at least 50% effective. So 66 is good. And flu shot isn't even 90% effective. So I wouldn't worry about that. The second part of your question is for people who will have allergic reactions or who are immunocompromised. I think that data need to be examined. I have no idea. When and if, I assume it's a when and not an if, Johnson & Johnson applies for the Emergency Authorization Act, they will have to submit all those data about people who were immune compromised and participated in their trials, people who had history of reactions, allergic reactions. So it may be that that shot is better, that vaccine's better for people who have other conditions or allergies, but I don't know the answer, and we don't know the answer until those data are revealed. So, but it's a good question. It's an important question. For now, if you have mild allergies, you can take the Pfizer or the Moderna vaccines. It's just you should stay at the site the place where you got your vaccine for about 30 minutes or so. They recommend that most people stay there at least for 15, just to make sure, 15 minutes. But if you have a history of allergies, then, stay there for at least 30 minutes.
Thank you.
Mm-hmm.
Did anyone else have any questions for Dr. Simon? I did have one question that was submitted. What is the difference between actually having antibodies from having COVID versus the vaccine?
Right. So the vaccine, you will eventually, you will produce antibodies, and if you have COVID, you will produce antibodies. It's just we don't know how long the titers, the levels of antibodies you get from a vaccine, the COVID vaccine, will last. That's what we're studying. That's what people are studying now in those phase 4 clinical trials to see if they need a booster or not every year. That's what we were discussing earlier. The research that's out so far on people who've had COVID, their antibody titers, their levels of antibodies have go down, and thus do not seem to produce a sustained response to COVID, meaning you could get reinfected. So that is why you have to get the vaccine, even though you may have had COVID sometime this past year or so. So because of the immunity, the sustained immune response. So that's why we say you must get the vaccine, even if you had COVID. And in general, the guidelines are, there's no real guidelines, but in general, they say, about 90 days from the time you got you were diagnosed with COVID to the time you get your first shot, your vaccine in general. But that's rough, and there's not there's not hard data on that. It's just a guideline.
Thank you. Yeah, because my follow-up question was going to be how long those antibodies last for, but you kind of covered that as well in there. So
yeah, it's so hard because while there's some data and research out there, there's still a lot of things that we're learning, right? And that makes this harder to message from a medical and a public health standpoint.
Most definitely. Did anyone in the audience have any questions for Dr. Simon? Just checking in with everyone.
I do have a question, Dr. Simon. So you mentioned earlier that the flu shot is not even 50%, that it's not 100% effective. What percentage is the flu shot? And that could be a reference point when speaking to family members or encouraging others to take the COVID vaccine. That way we have some type of reference, to something that we are familiar with.
Yeah, so it changes year to year.
Okay.
So year to year, the people who produce the companies that produce the flu vaccine, and there are many companies, we have lots of variations of the flu vaccine. That's a really important point. Why? Because first of all, some people question, well, why do we have so many different companies producing COVID vaccines? It's just, that's how it is, because one company can't produce the whole world's supply. And plus, we may find out that one way of producing a vaccine is better than another. So that's why we have multiple companies with the COVID process. But in terms of the flu shot, the influenza vaccine, every year, the scientists get together and kind of try to anticipate what are the most common strains of influenza that are going to cause infection, concerning infection for this upcoming year. So they try to predict that. It's quite fascinating science. And sometimes the efficacy of the flu vaccine is only about 45 to 55% in that range. And so if that gives you a good marker, that's about where it is. Sometimes it goes to 60, 65, sometimes, but like 2019, I think 2019 to 2020, I think the CDC had said that it was about 50%, if that, effective. Again, because because there's so many strains of influenza, there's so many types. And so the scientists really try to predict which ones are going to be the most prominent, prevalent types during that upcoming year. So it's different. It's different than coronavirus, and that's why the vaccines are different. That's why I would emphasize, Melissa and Alicia, to your family members, different, and it's different technology.
Thank you.
Mm-hmm.
I had a question about so you mentioned, Dr. Simon, that it's like new technology. That's like another, I feel like, myth that I've been hearing a lot lately about, the mRNA vaccines being really new for like COVID-19 specifically. I know that concept has existed for a while, I believe. It's just that I don't know how many vaccines have been developed that way. And so there has been some like misconceptions about how the safety of that type of vaccine.
Yeah, again, mRNA vaccines have been definitely studied, but never produced this quickly and this robustly. And so this is new technology in that sense, but not new. It's new that we've been able to create 2 mRNA vaccines this fast. That's the new part, the speed. And the fact that both of them have been tested on tens of thousands of people. And actually now several millions of people have received the mRNA vaccines with very, 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 very few bad outcomes or relatively bad outcomes. I think that that's a testimony to the science being robust and that it being safe, because many of us now have received the vaccine, both doses, including myself, and nothing's happened. If something was going to happen from the vaccine, it would happen usually within the first month of the second dose. So I'm still here. I'm good.
We're glad you are so with us, Dr. Simon. No, but that's really helpful. I always try to kind of defer to the science of things whenever I get asked by a family member. You know, everyone's cautious, and you know, rightfully so in many cases. I know there's a lot of mistrust with just trials that have gone wrong in the past. So you know, I get it, and you know, there has been a few situations too where a family member has spoken to their PCP or the primary care doctor, and they've asked them, like, if there's any downsides to getting the vaccine. And I think this is probably just an anomaly. I hope this isn't happening that often, but one of them did say, like, oh, if you get the vaccine, you might not want like your daughter to get it or someone else because it may cause infertility. And it's just, I know that's not true, but like true. Unfortunately it has been said here and there. I don't know why, but yeah.
You're right. I've heard that myth. I've heard that COVID-19 vaccine can affect women's fertility. No, again, it goes back to my little thing about the vaccine goes into your body. These 2 mRNA vaccines, they go into your body and they train your army to attack the coronavirus. They come in with their little signs and posters that these are the wanted people, these are the wanted viruses, and that gangster spike protein you got to attack. And that's what they do. It has nothing to do with your ovaries and your uterus and your reproductive system. The vaccine goes in and just focuses on riling the troops up of your army, your attack army. That's it. That's all it does.
Thank you. And I had a question that might kind of follow along with possibly some of the myths going around, but is the reaction or side effects of the vaccine worse for people who have already had COVID in the past versus those who have not?
We don't know. Some of us are kind of jokingly hypothesizing that those of us who had a little more side effects from the vaccine or because we had the infection at one point and we didn't know it. We were like asymptomatic. But we don't know.
Yeah, and my younger sister had gotten the vaccine, and I think she was saying how she just had a lot of fatigue and was tired. And one day she was just like passed out for part of the day, and then after that she was doing fine, just fine.
Yeah. It can, the second shot can kind of put you down for a few days, but then you're back up. But I also fully recognize that some people can't be put down for a few hours, let alone a few days. And that's a big deal. But then you also have to weigh it against the what happens if you get put down seriously in a hospital with COVID infection, and that's even uglier. So that needs to be balanced within that consideration.
Thank you. And then also someone had asked, for when you're getting the vaccine, do you want to get the second shot in the same arm as the first shot, or it doesn't really matter?
It doesn't matter. Usually I say you should get it in your non-dominant arm. So if you're right-handed, like I got both shots in my left arm because the last thing I need to do is have a sore right arm when I have to do everything with my right hand. I mean, I'm a little ambidextrous, but not that great.
Yeah, it's kind of like the same thing that we say with a lot of just common shots that you get at the doctor's office. You want it in your non-dominant hand, pretty much.
Yeah, for sure. It doesn't matter. It didn't make me hurt more the second time.
Thank you. I know we've got like a little less than 15 minutes. Did anyone in the audience have any questions they'd like to ask Dr. Simon? Any stories anyone wants to share? What's going on in their family with the vaccine?
Yeah, I came in a little bit late. I know people were talking about this earlier in the conversation, but I heard that, even if two people have the vaccine, maybe doctors aren't recommending for them to be together non-socially distanced just because there's other strains out there and such. Like, if two people are vaccinated and they don't hang out with anyone else, like, is that still a risk, or like, what's the situation with that?
I'm sorry, Sabrina. Can you clarify your question? So if two people live in the same household and they're both vaccinated, what's the question?
If two people from different households have the vaccine,
Oh, okay.
they took both shots, is it still not recommended for them to be together?
So yeah, that's we don't know, right? So look, all of many healthcare workers are vaccinated at this point. And we still, when we sit next to each other and are in the same room, like in the hospital, we still wear our masks and we still physically distance to the extent that we possibly can, but we wear our masks because we don't know the answer to the question that that needs more time to be studied in the phase 4 clinical trials of these vaccines. And that question is, if you are fully vaccinated with Pfizer or Moderna, for example, can you still get coronavirus? And if you can get it, what happens to you? But more importantly, because we seem to have that data that says you won't get, you may be just asymptomatic and you won't get really sick. But we don't know the answer to the question of, can you then give the coronavirus to somebody else? Are you still contagious if you have the vaccine? So I think that's the problem, and that's why we can't say, well, once you get vaccinated, you can go see grandma. We're not there yet. We need at least probably we'll know by summer. We don't know.
Got it.
And we also, and for that same reason, we also don't know how long the antibodies that you get, that you create in your body, your army of defense, how long they last for. So then we don't know, like, if you need a booster shot every year, like you get a flu shot every year. We don't know that yet because the response to the vaccine hasn't been studied long enough.
Thank you so much.
Sure.
Yeah, thank you for your question and for all that information, Dr. Simon. Did anyone else have any additional questions? So a couple questions that I had gotten from some folks is, what would be the best way to sign up for the vaccine? Where might be a good place for them to do that? Things of that nature.
Yeah, so when it's your turn, meaning your tier, there are many different ways to sign up for the vaccine. If you have a primary care provider already, I would go that route. That's probably the easiest route. If you do not have a primary care provider or clinic that you go to for general routine healthcare, that's where it becomes more complex. So that's where going, if you live in the city, going on the Chicago Department of Public Health website, they do have online scheduling, which is, I know, not ideal for many people, through ZocDoc, ZocDoc. They also, over the next few weeks, the Chicago Department of Public Health and many other organizations are creating these, what they call strike teams, which will be kind of areas that will be set up in different community areas at different time points going forward in time, where you could go and get your vaccine. But it's a process that is complex, and I would say that this is where most of the stumbling has occurred, with trying to figure out how to deploy multiple opportunities for people to get the vaccine when it's their turn. So I think that's the general advice, and specific to your own community area, you would have to go online and look at it, because I do know there are, like, Oak Street Health partnered with Lurie Children's Hospital and a few other providers. I think it was 1 to 2 weeks ago in Belmont Cragen community area, and just did like a mass vaccination, or it wasn't so massive, but several, I think a couple thousand, 1,000, 2,000 people got vaccinated during that time. So there is a link that Nemo put in the chat. But I would say this is the hardest part, is trying to figure out where to get the vaccine.
Mm.
The easiest place to start is your clinic, if you have a clinic that you go to for care.
Yeah, I feel like within this whole process, always telling people to kind of connect with their primary care if they have one, that doctor to kind of help them navigate, best next steps and things of that nature. I know that's kind of what we've done in my family. But
And of course, I know that an even more suboptimal option is that some pharmacies like CVS will have some vaccines, but again, I know the process there is, again, cumbersome, but it is another option.
thank you.
Mm-hmm.
And just to follow up, Dr. Simon, sorry, I apologize for my dog.
Hey, your dog wants to ask a COVID question.
She does. Her name is Frida. She's so
Great. Oh, after my favorite, Frida Kahlo.
yeah. But so just to follow up with what you're explaining in terms of the vaccine availability, how can people know when it's their turn, or what tier we're in?
Yeah, so right now, so again, on the Illinois Department of Public Health website, I believe they advertise a tier, as well as the Chicago Department of Public Health website also advertises a tier for COVID vaccination. So right now, healthcare workers are still eligible. We're still at 1B. And that means up to 65 years old and older can get the vaccine. And then frontline workers, so essential workers, frontline workers. Those would be the people who are eligible for the vaccine right now.
Thank you. Great question. Anyone else have any additional questions? I know we have about 5 minutes left in the session.
I have a question. So COVID has caused a lot of problems, a lot of deaths. I've lost family members to COVID. I've lost 2 members, and it's turned our world upside down, literally. Why can't we make then a mandate for everyone to get vaccinated and get that mass production going? And I know this is a difficult question, but I mean, I just had to ask.
No, it's a totally appropriate question, and I feel you. Trust me, I'm a healthcare worker. I would love to be able to mandate vaccines for everybody, and not just COVID. Trust me, HPV is another one I wish everybody got, to get rid of cervical cancer off this planet. So the quick answer is, when a vaccine is authorized only under emergency use, it absolutely can never, it's by law, it cannot be mandated. So that's the first and foremost reason why no one can mandate a vaccine, a COVID vaccine. So even healthcare workers who work in the hospital and the ICUs, all that stuff, we can't be forced to take this vaccine, even though we're told we have to take the flu vaccine every year, right? And unless we have an allergic reaction or some other very specific contraindication, which there are a few contraindications to the flu vaccine. So we have to get our flu shot every year, healthcare workers. But the COVID vaccine cannot be mandated even for healthcare workers right now because it is under emergency use authorization approval by the FDA. So by law. I know, Paulina. Does that answer your question? And that's
Yes, but I think it does. I didn't know that. There's a lot of education that still needs to happen into the general public, right? But
right.
given the severe consequences, I mean, the deadly consequences of COVID,
Right.
once it's fully authorized and it's out of the emergency authorization, do you think it will be mandated for everyone? I mean, that's one way of stopping the pandemic. Earlier you said, would have to take 80% of the world to
Right.
get vaccinated.
Right.
But, there's people that are reluctant and there's lack of information. So how are we going to return to what we used to know before? Now, I'm afraid,
I'm there with you. I mean, look at some of the other vaccines that we want all infants to get so they can, so that they don't get really severe diseases, rubella, rubeola, right? All these things that we give our vaccines that we give our infants, that there is a growing number of people, so-called anti-vaxxers, that are exposing their children, and when they become older, adults, to very deadly diseases that are potentially more devastating and deadlier than coronavirus if we didn't get vaccinated. So we do have herd immunity in some communities for these deadly diseases that we get vaccinated against, but there are some communities where these deadlier diseases are coming back because there's not herd immunity anymore. So it is a big problem. It's a big issue. And there are people working on it, like trying to figure out how best to message this and communicate this. But that's a hard nut to crack.
Yeah.
I don't know the answer to will coronavirus or COVID vaccine be required once it's officially approved and no longer under an emergency authorization. It may be. I don't know. I mean, it's devastated factories and whole workforces. So you would think that that would be something we would do. But I don't know. That's a hard one.
Right. Thank you. Very informative. Thank you so much.
Yeah. Thank you for the question.
So I know that we're at time, but I did want to, thank everybody, especially, especially Dr. Simon. Thank you so much for giving us some time today to answer some of our questions, and to all the participants today on the call. Thank you for coming and being open with us and sharing your questions. We appreciate it, and definitely want to come together and help spread good information. So hopefully we've done that today and given everybody a good, safe place to do that in. I didn't know if anyone else would like to have any last minute comments, things of that nature. If
I
not,
think we're making headways with pregnancy and lactations. I think we're making headways with the message that the 2 mRNA vaccines that are approved right now in this country are safe in pregnancy and in lactation. And so if you are an essential worker or a healthcare worker, you should consider getting the vaccine if you're pregnant or lactating.
thank you.
And if somebody denies you, because I know in one county, not in Cook County, but another county, somebody was denied the vaccine who was a frontline worker and pregnant. That's not correct. No one should deny you the vaccine. So ask somebody else for it.
Thank you. Thank you again, everyone. And today's event was recorded, so we will be sharing the recording and, spreading all this good information we've got going on here. And I will continue to say thank you 100 times over, just because that's what I do at the end of events. But again, thank you for your time, and everyone have a wonderful rest of your day. Stay safe, stay warm.